Hi, it's that time. I get to do an Instagram Live today. I'm going to wait for some of you to start coming in so I can say hi to you and see who's joining us. We're just getting started. There's Jennifer. Hi, Jennifer. Hi. And there's Makeup by Shannon and Sandy Sunflower. I love you guys. Thank you for joining us. Some of you have names that I don't know, so or don't recognize, meaning I don't know how to say your name, but I see you, and I'm so glad you're with us. This is so exciting. Thank you. I've been wanting to do this live with my friend. It's been 2 years since we've done one together. There's Jen. Hi, Jen. We've been wanting to do this for a while, and for one reason or another, and schedules, you guys know how that is. It's impossible. So he's standing by, Dr. Howard Sobel. I'm going to bring him on to join us, and hopefully it'll go through, technology. But today I really want to focus on oh, hi, I see you all. Oh my gosh, I'm so excited that you're joining me. I really want to talk about also things that are on your mind. So I'm going to tell my sidekick over here that if there's any important questions that you guys have regarding, makeup, obviously, and makeup for skin over 40. I know we have shipping issues. Trust me. Don't pick on me today. Please. I always, thanks, Jen Giamo. And hi, Glamazon Beauty. Oh, another friend of mine. This is not a forum to pick on my shipping issues, but my team knows we're very aware and we're taking care of stuff, so don't worry. But this is an opportunity really to ask me yes, I worked, Jennifer, with Way Bandy. That's so funny you mentioned that. I didn't shoot with Way Bandy, but he would come to me. Way Bandy was a famed makeup artist, and I worked in a makeup store in Manhattan called the Makeup Center back in the 80s, and he would come in for specialized makeup for his shoots for his makeup kits. So what a brilliant man he was. Anyway, so anything about makeup? Oh, tell Lori hi then. She's challenged today. Thank you. Only foundation you wear. Oh, your order's arriving today. And wait, we're still trying to get Dr. Howard Sobel to join us. So give me a moment because he's standing by. I want you to ask anything that's on your mind. And if we have a number of people asking the same question, we can ask Dr. Sobel, you can ask me. But I told him that I really want to speak to the best treatments that are available to us out there. I know he's on the cutting edge of something new. Oh, he joined. Oh, so how did we get him on? He's there. Oh, Howard, hang in there. We'll get you. Hang on. Just hang your horses, as they say. So he's on the cutting edge of something. He starts telling me about it today. Oh, there you are.
Okay, there we are.
We made it. I'm so glad.
I'm telling you, I love your glasses, I tell you.
I wish I didn't need them. I mean, I could do it without it, but if I want to see the comments that are coming through, I cannot see until I put on my readers.
Well, if you wear those glasses,
they're
you
good.
don't have to do anything around your eyes.
That's right. Hi, Amber. Amber's my brand ambassador, and she's a fan of yours, Dr. Sobel. So I'm going to call you Howard because you're my friend today.
We're good.
When I come to see you, you're my doctor. He's been my dermatologist for 1,000 years, and don't we look so good?
It's funny, I used my hyaluronic acid just now, and I see I'm a little shiny. I didn't rub it in enough.
Oh, but
we'll talk about that.
That shine is youth. I mean, why not? But I was telling my friends who are joining us that you're on the cutting edge of some new things. And as you were telling me earlier about it, I was like, okay, that is made for me. I need that not just for my hair, but for my skin. But I also I told everybody that if there's any particular questions regarding dermatology or makeup, and there's a repeat of those questions, I will definitely try to get those answered for you guys from Dr. Sobel and from me. So I want to start off by saying that you are one of the most brilliant doctors I have ever ever encountered, and I'm not just saying that because we're friends. I mean, I have never had a treatment from you where I've walked out and went, okay, I don't look like myself. Everybody who goes to him comes away going, I just look refreshed. You don't overdo it. You're not fake. And that to me is critical, because I do believe that if you want to get something done, you should. For those of you who don't believe in it, that's fine. But I think that the beauty of what you do is keeping people young looking. So I want to just talk a little bit about what you're doing on a regular basis with most of your patients. Like, is it mostly Botox? Is it mostly fillers?
You know, it's a combination of everything. There's no such thing as just doing Botox, just doing filler, just doing laser. As we age, you know, the skin cells slow down. What does that mean? You've seen the complexion of a 12-year-old, right? And you've seen the complexion of a 50, 60-year-old. If the 12-year-old has this healthy glow, her skin turnover is about once every 28 days.
I know.
All of a sudden, you get to your 30s, 40s, and 50s, the turnover may be 40 days, 50 days.
Yeah.
And what happens? You get dead skin cells stuck on the skin.
Is that dryness? Is that the dryness?
Well, dryness as well, but dryness has to do with over using harsh ingredients on your skin.
Uh-oh.
Okay, losing the moisture in the skin. That's natural. You don't keep the moisture in, because what happens? Our skin barrier gets depleted.
Okay.
So the water gets out, the pollutants get in, they damage our healthy skin cells.
I have a question.
Yeah.
Is there a treatment that puts moisture in the skin? Don't laugh.
No, of course it is. There's hyaluronic acid. We do hyaluronic acid.
I don't mean skincare, because that I live on. I live on your skincare. I'm in a treatment in your office or other dermatologist office where people could go and literally get hydration from the treatment.
You know, there's various treatments that doctors give for hydration.
Okay.
I'm going to be honest with you. I don't believe injection, putting moisture in the skin in injections really works well. There are a number of products out there that say they do, and it's very, very new. And they inject hyaluronic acid in small doses around the face.
Yeah.
Okay? And it's supposed to keep moisture in the skin. I'm not sure if it does anything different than washing your face and putting your moisturizer on while your skin is damp. People don't realize that. They blot their skin is dry, they put the moisture on. What is it holding? It's not holding anything in. You want the water in the skin, then you want to put your moisturizer on. And why hyaluronic acid? Hyaluronic acid is hydrophilic, which means it draws water from the air. That's our hyaluronic acid. What makes ours different? It has hyaluron. Hyaluron is a small molecule of hyaluronic acid. You can put all you want hyaluronic acid. The molecule is so big, it sits on the skin. So the hyaluron is a small particle of hyaluronic acid that gets into the skin. And when it gets into the skin, people are getting older, they're getting dry. You want to keep all that moisture you can in the skin. And my formulation is patented, and the patented has a base. That base actually increases any ingredient cream that you put it in. So it's going to increase the absorption of hyaluronic acid, retinol, vitamin C, anything. And it also helps the depleted skin barrier we talked about.
Yeah.
It lays a clean skin barrier over the old one. So the water stays in, the pollutants stay out, our healthy skin cells don't get damaged from the free radicals that form from smoking, pollution, from stress, anxiety, and everything else, just natural aging process.
So you can see how much I use this every night. And I'm going to tell you, I have access to so many different products. There has been nothing that's kept my skin hydrated like this. And I put this on, I feel like I've had like a medicinal treatment, because I cannot believe how it transforms my face. And so can we put the name of these things in the we're going to add, so for anybody joining us, a couple things I got to get out of the way. Anything I mention, we'll put a link to in the chat. if you're joining late or if you're watching this the first time, you can watch the whole thing. It'll live on Laura Geller, and so you'll be able to come back and see it. Also, we're going to have two winners at the end, right? Two winners. I want to make sure I get this right. Two winners at the end, and I'm not sure. What are we getting? Okay, wait, I'm going to tell you. So you need to go enter now. So enter now to win. And at the end, you're going to get something from Dr. Sobel and then something from Laura Geller Beauty. How much? $250 from each. Oh, that's amazing. Oh my God. Is that for his skincare? Yes. Oh my gosh. Okay, you're going to get $250 from Laura Geller Beauty and $250 from Dr. Howard Sobel for any of his skincare. What? Wait. I'm sorry. I'm getting my information over here.
That's okay.
So, because of course I should know that before I do this. She told me to keep going, so I'm going to keep going. So
Laura, I also want to say, you know what we're going to do? Just as an additive, I was talking to Kara, my office manager, just since you're such a good friend of mine and this is so much fun. We're going to increase any of your clients that come in for any procedure will get a 10% discount.
Oh,
all
awesome.
they have to do is mention Laura Geller.
Oh my God,
and they get a 10% discount on any of the procedures, whether it's Botox, hyaluronic acid, lasers, all the things we do here that are fun. They'll get a 10% discount.
That's awesome. And by the way, Dr. Howard Sobel is on Park Avenue here in Manhattan. So if you're in the New York metropolitan area or visiting and coming to visit us, you need to make a stop there. Listen, I've seen what's out there, and you know, you're putting your hands in the hands of somebody who is so skilled. So don't take a chance on that. And somebody just wrote, that's so generous of you. So, and it is. So thank you for doing that. What would you say is the most common treatment? I mean, I had asked you, like, what are most people coming in for? But what is the most common treatment that people come for?
I mean, obviously, it's fine lines and wrinkles. Your skin becomes crepey and pigmentation.
So what treatment is that? What treatment is that?
Treatment is multiple treatments. As I said, there's no such thing as one treatment that treats all.
Okay.
You have the Botox that treats the fine lines, the wrinkle lines, the glabella lines, those stress lines, those lines that form dynamic lines. When you smile, crow's feet. When you grimace, these levens. When you raise your eyebrows, those lines on your forehead. And you continue to do that, like folding a piece of paper, those lines will become embedded in the skin and you'll never get rid of them. So some people say, when should you do Botox? But there's no time. Look at your mom, look at your dad, and you look at your skin and you're starting to get those little lines. That's the time to do Botox.
Okay.
Then filler. As we age, no different than a house that crumples and the framework that winds up, you don't have the framework to hang the wood on.
Right.
Now in your skin, you don't have the framework for the skin. It gets depleted. The collagen decreases. The elastin decreases. Everything falls. So you need an injectable. And those injectables.
What's it called? What's an injectable called?
Usually hyaluronic acid. It comes in Juvederm, Restylane. I don't think it matters the name. They're very similar products. They're just a different name. And what we're doing is giving you back the fullness that you lost. We get this nasolabial fold here. Why?
Yeah, what do you put in there? Is that filler or Botox?
We don't inject it anymore. We used to inject it and people looked like a cat. So now we inject it high on the cheek and we raise the cheekbone. And by raising the cheekbone, you get rid of the nasolabial fold. You no longer inject the nasolabial fold.
Oh my gosh,
you don't want
I
to
didn't
look like a cat.
That.
So it's all about lifting without getting a facelift. We can also inject around the jawline to give a sharper jawline because we all get these jowls. And then our skin gets pointed. So we inject in this area as well. Give you a nice fine line, lifted cheekbones. Also the temples hollow out as we age. You can inject the temples, and because some women pull their hair back and they hate it because their temples look hollow. There's so many things we could do with filler, but your question was, what's the number one? Of course, number one is still Botox. Number two is injectables. Number three is lasers to get rid of pigmentation. Everyone's heard of Fraxel. Now, Fraxel has a 3 to 5 day somewhat downtime. You get a little redness, day 3 and 4, you wash your face, it all comes off. So
What is it doing, the
it's
Fraxel?
actually reacting to the pigmentation, the sun damage, the tinting.
Okay.
We used to call them liver spots. They're not. Those spots are not just cosmetic, okay? They're also medical. Those sunspots can become skin cancers.
Yeah,
They're called actinic keratosis, and they could become squamous cell carcinomas. So when we treat Fraxel for pigmentation, we're getting all the sun damage as well. Then you got the older age group, okay? That Fraxel's not enough. They need something called a new laser we have. It's my favorite laser. It's called Helix laser. It's a CO2 laser.
Okay.
It gets rid of, it resurfaces the skin, gets rid of fine lines, wrinkles, pigmentation, and those are for people that are a little older. In the
What's
30
older
to
to
50,
you?
old to me is late 50s to 70s.
Okay.
People from
Okay.
30 to 50, Fraxel's fine. Then the people below 30 just have a little pigmentation. They could get the Clear and Brilliant. It's like a mini Fraxel. And you do it every month, and you don't get no downtime.
No downtime.
Same effect, but multiple treatments.
Okay. The one that's for older, how much downtime is there? And it's because it's much more invasive, I would think.
5 to 7 to 10 days.
And then
that depends.
how
I
often?
say that it depends how deep you want to set it. The Helix laser is a great laser. You could go deep. You could set it very superficial and very, very deep. And depends on the person's age and what their expectations are. If they want to really resurface the skin, they're going to probably have 7 to 10 days downtime.
Right.
Sometimes you need downtime to get a result.
Yeah, I know. But here's the question that everybody's thinking, because I'm thinking it. So after you do a Fraxel or that treatment, don't ask me, I forgot the name again. What's the name again?
Which one? Clear, Brilliant, Helix.
Helix. I don't want to forget that because I think I need that. You can't go in the sun ever again, right?
No, people always say that I can't get it in the summertime. And when should I do it after? Sometimes I like to do it before the summer, because now your face is clean. It's like painting a wall. It's totally clean. And because you had this procedure and because you paid a lot of money, you are now going to go out in the sun. If you do out in the sun, you're going to wear sunscreen.
Of
course. We didn't talk about that. You've got to wear a sunscreen and put it on every 2 hours if you're out in the sun. And it should be a broad spectrum sunscreen that covers UVA and UVB.
Okay. I didn't realize you have to do it every 2 hours.
If you're out in the sun, if you're in your office, you don't have to do that.
Right.
But some people don't realize when the companies say an SPF of, say, 30, what you should have, at least a 30.
Right.
A 30, if you at 3 hours, is no longer a 30. It may be a 15.
Right.
It may be a 10. If you took even a 15 and applied it every 2 hours, we would be better than having a 30 or a 50 and applying it every 5 hours. So people don't realize that.
Do you make a sunscreen?
Yes, we make a sunscreen, and I believe it's a 50.
And is it clear? It's clear?
It's clear, native titanium dioxide. And it's not that, like, you think of the lifeguards with that, white nose. It's micronized. Because it's micronized, the particles are so small that they get into the skin, and like makeup, you don't see it. You don't get shine, you don't see it, okay? And always know that the sunscreen comes after your treatment.
That's just what I was
always last. It's always last.
So it should be the last thing you do, but then you should put you put your makeup on after it?
You could put your sunscreen on. Yes. You put your sunscreen on, you put your makeup on. Well, no, your sunscreen should go last. Put your makeup on and then put your sunscreen on.
Really?
Yes.
Oh.
The sunscreen always goes last.
Can you put sunscreen on top of foundation?
Of course you can, because it's not greasy, it's not oil. Okay. You want to protect your skin.
Okay. So here's a question.
Because if you're putting makeup over it, you may not get the full protection of the sunscreen.
Right. Okay. We came out with, finally, after I've never had one, a foundation that has SPF 50. It's called Better Than
Then
Block.
you could use that, and you together, and you don't need your sunscreen. That is your sunscreen. So you have your makeup and your
But you have to
sunscreen.
put this on every 2
If you're
hours? This is
out in the
if
sun,
you're
the
out in the
answer is
sun.
yes. I know that's a pain, and very few people do it. But if you
No,
really want to look at it physiologically, you're going to get a lot of sun if you don't put it on every 2 hours.
Yeah,
If you're
no.
sitting at a beach and you don't put it on, and if you go into the water, you may even have to put it on even more frequently. But what
Okay.
you have there is great because the makeup and the sunscreen. So you solve the problem of when to put on the sunscreen. You can put that on last because you have your makeup and your sunscreen
Right.
there. But you're not putting on makeup. If you're not putting on makeup, you're going out to the beach. A lot of people don't need makeup when they go out to the beach. Just put your sunscreen on last.
Right. Okay. Just to remember, everybody, put your sunscreen on last. Because truth be told, when I'm on air on QVC, people ask me that question, and I'm always like, let me think, when does spackle go? When does sunscreen go? I've been saying that they should put their sunscreen, then put spackle because it locks it in. But I think, to your point, it makes more sense to do the SPF last.
A lot of people don't even realize you only get about 10%, but 10% is still 10%. You get 90% from UVA and UVB, but 10% you get from these computers. Blue light. Blue light could actually cause sun damage.
Yeah. Oh, so this is good. Okay, wait a minute. This is spackle mist, and it's for blue light. It's to set your makeup that you use after you've done your makeup, and it protects. It's actually just a protect. It sets makeup, but it's a protection against blue light technology.
Well, that's great. Then you've covered everything.
Yeah, no, it's really it's a very fine mist. Somebody asked, what I asked you is, how do you keep putting a sunscreen over makeup? But you can, because it's clear. So you press it in. You know, like you don't have to worry about like.
Something. But if you're going to be at the beach, you're not wearing makeup. Okay,
No.
you're putting maybe a moisturizer
you
on.
Can wear.
Okay, but that you can wear because it has a combination. Yes.
Right.
You're not usually putting full makeup and going to the beach and then put your sunscreen on.
No.
And then your makeup melts and it doesn't look great.
Not if you're wearing eye kajal eyeliner, because those don't come off even if it's 100,000 degrees. So if you care about how you look at the beach, personally, I don't. I'm like one of these people who just, lazy girl guide to makeup. If I'm going to the beach, I ain't putting anything on but sunscreen. Somebody asked how to enter. So I want to make sure I tell you people how to enter, because it's a great giveaway. What do they have to do to enter?
Go on our Instagram page.
Go on our Laura Geller Instagram page, which you're on, or Dr. Howard Sobel, and then what? And just write enter?
The rules to enter are in the caption.
The rules to enter are in the caption. Did you hear that? Okay. So on Dr. Howard Sobel's page or my page, the rules to enter are in the caption. And then at the end, we will be picking 2 winners today. So no, but I think sun protection, most of us didn't do it until like in the last couple of years. Like we just, especially the old timers, we just did everything wrong. And I've got, look, you could see my hyperpigmentation.
Well,
it's terrible.
That's a Fraxel. You're not necessarily ready for a helix, but if you find those little crepiness, and it looks like you've seen crepiness around the mouth, and cheek areas, those fine lines. Fraxel's not going to get rid of that. That's going to get rid of that pigmentation you just showed me, but the helix is going to get rid of those fine crakiness, that crepey skin, and you see it around your mouth and certainly around your eyes. The first sign that you see of age is around the eyes. Why? Because the skin is thinnest in that area. Very
Can't get
fragile.
moisture in there easy.
People smile, it gets crepey. And that's why very often when we do a laser, sometimes I just do a laser underneath the eyes. We don't even have to do a laser the whole face.
I have a question. Sometimes I see women, respectfully, some of them are my friends, and they're very shiny. Their skin's like too shiny, waxy looking. And I know they've had treatments, and I'm like, oh my God, they don't look natural. So shiny, their face, their own skin. What is that?
Well, there's some kind of silicone in their product.
No. I don't mean makeup. This condition of their skin is shiny, almost like they may have done, I'm assuming, too many peels or something.
I could think about, it was shiny. We used to think about, but people don't do it anymore. People used to do phenol peels, and the skin would look white and shiny.
Oh my!
But if you go too deep, even with a CO2 laser, your skin can become shiny, which means you've taken off too much skin.
Okay.
Okay, you don't want to do it. There's a happy medium between, just like with fillers. You know, you don't want your lips to walk in the door before you do. You
Yeah,
don't
it's
want to look
funny.
like a Cabbage Patch doll. You don't want to sit at a table and so someone looks over, oh, I wonder what she had done.
Well, it's funny
You want
you say
someone to
that.
just look at you and say, wow, she looks great. I'm looking at you right now. You look great.
Yeah, thank you. That's because I have you in my life, and I will tell you that people don't know that I've done things, and I don't even know. I trust you so much that when I go to you, I don't even know what you're doing to me. I just know you're like touching all of my face, and I'm like, okay, whatever. Like, because I'm probably not going to understand it anyway. And people are like, well, what does he do here? What is he doing here? I'm like, I don't know. I just let him shoot me up. I don't know. I really, as long as I look good, I don't care. But it's so funny that I want to know what lasts the longest.
You know, fillers last from 4 to 6 weeks, 4 to 6 months, excuse me. Botox lasts about 3 to 4 months, and there's something called Sculptra.
Oh, I've heard of that.
Yes, you don't see the results instantly. You inject it, and over a period of months, it builds collagen and elastin.
Ooh.
And that could last up to a year or even 2. Okay, some people don't like that because you don't see instant gratification. You inject it over a period of time. It's different than hyaluronic acid. You fill it up and you can see it instantly and go to a party. So they do differ.
Okay, you know what it is? I just think, hi Jill. Oh my God, one of the models from QVC. I love seeing all our friends join us. I just think you're talking about so many different things. If a patient comes to you for the first time, they have to get that you have to see what they need. And could you do the treatment right then and there? I mean,
I kind of pretty much always do that, except, you can't, a laser that has downtime, someone has to plan for it. So you can't just say, okay, let's do it now. Sometimes once in a while I say, oh, I have plenty of time. Let's do it now if you have time.
Right.
That's very important. We also should talk about, and we mentioned it before, hair loss.
I have really bad hair loss.
It's hard to see from here.
No, I'll tell you, there's, forgive me, I always had thin hair, and I looked at my mother as she got older, and she had hardly any hair on her head when she was in her 90s. God bless. I wouldn't care either if I made it to 90s, but I actually have some extensions in my hair.
Oh, you do?
No, but from the scalp, I don't have extensions, and I put a brown powder in there to fill in. But I was on breast cancer medication. I am officially off of it, 5 years clean. So, great. But I don't know if it's going to start coming back in now that the medicine's gone. Like, what do I need?
You have to understand that by the time you're 50, almost everyone, 50 to 80%, have suffered at least some hair loss. Hair loss could start in your 20s, male pattern baldness. Female also have female pattern baldness. Male pattern baldness, you get a bald area, sort of in the so-called yarmulke area here, and in the front. Females get thinning up the middle of the scalp, and when a light shines down, you can see their scalp.
Yes, when I'm out in the sun, you can see how thin my hair is.
We didn't have much treatments. We had some topical treatments that would block dihydrotestosterone, which would thin out the hair. But now we have something called TEDS, Trans-Epidermal Delivery System.
TEDS.
What it does is it's an ultrasound and sound waves. But that by itself doesn't do very much. The company gives us growth factors with it. And those growth factors are put on the scalp, and they're driven in with the ultrasound and sound waves, as opposed to getting PRP. Everyone knows about PRP.
Not everyone.
Well, you spin down the blood, and you take the plasma, and from that plasma, there are growth factors. And then you inject the plasma back in the scalp with the growth factors. And that works very nicely. The problem is, you got to take the blood, you've got to inject it back in the scalp, and that's painful. I've had that done, but now that we got the TEDS, and we got like the first TEDS in New York about a year ago, it does the same thing without the pain.
Wait,
now we have something very new.
You're not injecting anything?
No,
it's just the sound waves?
It's a topical, and it feels like massage. The ultrasound, as well as the sound waves, just massage it into the scalp, and it gets all the way down into the hair follicle.
I can't believe it.
And now we started. I'm sorry.
Amazing. How long is the treatment? How long is it?
Treatment takes 20 minutes. You do it once a month. and you do it for 3 months, and then you develop a certain kind of maintenance therapy. Just like you work out. You don't just work out and stop. Hair loss is forever until we find a cure. So you may do 3, and then you may do 1 every 2, 3, 4 months, just
Okay.
as a maintenance.
What's maintenance at home, though?
Not maintenance at home. We give you a topical as well.
What is the
that will help with
topical?
the hair loss.
Minoxidil?
Topical is a high minoxidil in men and finasteride, and you can't give that in women. In women, we give a high minoxidil and progesterone as a
And
replacement.
topical, not oral. You wouldn't do oral?
Yes, we just started oral. I just
Okay.
started giving 2.5 milligrams of minoxidil orally to men and women.
Howard,
and that's real.
I want to talk for the people who are listening, whoever's listening. Does it really work? Like, listen,
I do it on myself.
If I come into you, huh?
I do it on myself.
Yeah, but
I don't do anything.
You've got a gorgeous head of hair to
But
begin with.
But I started losing it a little in the yarmulke area, and so I do the TEDs and I do all the topical, and I just started doing since I'm doing it on myself, I'm doing it on patients now. We just added exosomes.
Okay.
I don't know if anyone's heard of exosome. No. Okay, exosomes.
Make it simple. Make it simple.
I'll make it very
I don't
simple.
get it.
We get it from a company that takes the exosomes from the placenta, the fetal placenta. The fetal placenta has, listen to this, 3 to 5 trillion, exosomes.
Okay.
Those exosomes are taken from stem cells. Everyone's heard of stem cells. So you have the stem cells that produce the exosomes, and the exosomes produce 300 growth factors. So when we get the growth factors from platelets, we may get only 20 growth factors from our platelets. When the company gives us, they may give us 30 to 40 growth factors.
Okay.
But now we add the exosomes. So we're adding whatever the company's giving us for the TEDs, and then we're adding the exosomes on top of that, and we're getting maximum results because the growth factors help open the hair follicle, decrease hair loss, and actually you get hair growth as well.
How do you know? Do you see? Do you take a before picture?
Small little hairs growing. Those vellus hairs that are very small become thicker and thicker, and that's the key of actually TEDs. Even before we had exosomes, what it would do, even if someone didn't get real regrowth in a bald area, they would get, especially for women, the diameter of the hair would get thicker. And if it got thicker, when a light shined on them, you wouldn't see their scalp. Okay,
makes sense.
And obviously, in a man that has a bald area, you want to fill it in, and that doesn't always work. I don't understand why some people do get some regrowth, some don't. But everyone gets a thickening of each diameter of the hair and a decrease in hair loss.
Does it matter what color skin you have? Like if you're a dark skin individual, can you get that treatment?
Anyone get the treatment. It has nothing to do with skin color.
Okay, and the next thing is, I know you're a Park Avenue doctor, and maybe other people do. How much is this talk?
Yeah, sure. It's $3,500
for how many?
For three treatments. For 3 treatments.
One?
3 treatments. So it's not expensive. 3 treatments, and then after that, depending. Now I have someone that's a very wealthy guy. He comes every month. We do a TEDS on him. Okay, and then we have other people after 3 treatments decide every 2-3 months they'll do 1.
Okay.
And then we have some people that do it every 6 months. Okay. So it really depends on the person. It also depends on how much hair they've lost. So it depends on their age and how much it bothers them and how much they want to grow it back. Okay. So it's all dependent on the patient.
Okay, and they'll get 10% off, which is amazing.
10% off.
Yeah. So
on anything, if anything they do here.
Do you take a before picture of their scalp?
Oh, you have to. I have some great. Unfortunately, I'm not going to be able to show it right here if I was prepared.
But
we have it on our site. If you look on our site.
What site? How do you get to your site?
Just look up Dr. Sobel at Dr. Sobel's.
We'll put a link to your site. So
Dr. Sobel at drsobelskin.com.
Okay, so because what I want to know is, I think I'm going to be that person because I want to come in for this, who's going to want to see before, and you're telling me after 3 treatments plus some work at home, I should see a difference in hair
You're
growth.
going to use a topical. You're going to use a minoxidil by mouth, and you're going to do the TEDS treatment, and we're going to add the exosomes as well.
Okay, I want to see that. Hi, Sarah. So I want to ask another thing. I'm going to be honest with everybody. I went to you many years ago, and you did something to, this is now on to another subject, sorry. If anybody has any questions about TED, call Dr. Howard Sobel's office about the hair treatment. But I want to talk about lips for a minute. I know so many people who are doing fillers in their lips. And many years ago, I came to you and you injected me in my lip and I was like, get off, no more. And I wouldn't do it because it hurt like heck.
Right.
What are we doing to make the lips, because as you get older, the lips thin out. And I see a difference on the people who do it must be doing it right. Their lips look fuller, but not weird. But then some people are getting carried away. I know who you are because I've seen you, and the lips look, they lose the shape of their lip. It just looks like duck lips. It's terrible. I mean, I know that's not patients coming to you. What are you putting in the lips
Well,
now?
let me, what I'm putting in the lips, let me understand. You have to understand the pathology of the lips, what it looks like. Your bottom lip, what do you think? Your bottom lip or your top lip should be bigger?
Bottom
What do you
lip.
think?
Bottom.
The bottom lip should be should be actually twice the size as your top lip. Should be
Wait,
one
top
third.
should be bigger?
No, one third on top, 2/3 on the bottom. Okay, so
okay.
twice the size. And people can come into the office that look like ducks. They tell you to inject their top lip.
I know.
You inject their top lip and they look like this. They look like a duck.
Can
You don't want to do that.
Fix that? Do you ever fix people's lips?
Well, of course, if they have too much on the top, you add it to the bottom. If they have too much on the top, there's an enzyme. You can dissolve it. I happen to, and I'm one of the few guys that use it, and you could say there are pros and cons. I love to use silicone in the lips. And some people are against silicone. I use micro droplets of silicone and 1000. And what you do is small little droplets, okay, and you numb it before so it doesn't hurt, like you said it hurt you.
Oh, it hurt me too much.
Or you could give a nerve block so it doesn't hurt at all, just like the dentist.
Oh.
Okay. But if you use silicone, 1 or 2 treatments, and you don't have to ever do it again. Now, people always worry about silicone because it got a bad name with breast implants, but we're just using micro droplets, and that's it. And I never would put too much in because we only put a little at one time. So I'll have a patient come back from 1 to 3 times a month apart, and that's it. They'll never get too much. When you go high, I also inject hyaluronic acid because some people don't want permanent filler. Permanent is good and it's bad. It's great if you don't make a mistake. If you make a mistake, it's bad because it's hard to get rid of it. So the key is to do small micro droplets and never get in trouble. But if someone wants a non-permanent, there's no problem using hyaluronic acid, but do it in proportion and do it with small little increments. And the person can come back the following week or the week after. You don't have to do it all at once.
Right.
Don't make that patient look like a Cabbage Patch doll.
Right.
Don't make those lips so big that you see that lips. The first thing you see is the lips.
Horrible. Oh my, and so many people are walking around like that. Okay, wait. I know she's not listening, so I can ask you. I have a very close friend. Doesn't matter. I'm not naming her, even if she should be listening to this, because this is so educational what you're giving us. This is like a free consult. She has a tremendous amount of lines, and she was not a smoker. 1,000 million lines above her lip.
Right.
And she always asked me, like, and I go, I am lucky. I don't have that. What do you do for that?
Those are perioral lines, which actually eventually people all get. You know, puckering your lips, kissing too much,
if you were
smiling too much.
If you were a smoker.
A cigarette for sure. Okay. Or naturally just get them from the sun. Okay. There's 2 treatments for that. I will treat it with a hyaluronic acid, which is temporary. As I mentioned before, I love silicone in that area. A small little amount of silicone fills the area in. You don't ever have to do it again. You have to be very careful and do very little. Then we go to the big guns. Once we do a resurfacing, a CO2, I'll do above the lip, and I'll actually go very deep above the lip, deeper than I would do on the cheeks and the forehead to really get rid of those little crevices. I'm sanding down the skin, but I'm using a CO2 laser to do it.
Okay.
And those are the 3 treatments that you would use. Chemical peels don't work. Chemical peels don't go
Topical.
deep enough. They don't go deep
No,
enough. The line is too deep.
right. Will the peel that you're talking about, getting down deep, will it be for good?
But for the CO2, you meant?
Yeah.
Is that what you mean? Yeah.
Yes.
You know, there's nothing that's forever. It certainly will last a good 10 years.
Oh, good.
But as you pucker your lips and as you age, as you get sun damage, some of them will reform, but they won't reform like they were before you came to me.
Can you put a nerve block in before someone does that peel? Because that's going to hurt
No.
like hell in that area.
Before you do the CO2,
Yeah.
before I do CO2, I'll give, because that hurts a little. I'll give someone a little Percocet, a Vicodin, a shot of Demerol, one of those,
Gas? Do
a
you
little
ever do,
Valium.
you don't do gas?
Yes,
do
we
you?
do gas, but the problem with gas is that you cover the mouth. So,
Right.
So when they're covering like something called Pronox, like the dentist gives you, they can take a couple of puffs, and then they take it off, and then we can do the lips. So you can go back and forth. I'd rather just give them a nerve block, the dentist does, and they don't feel anything.
Okay, I'm going to tell her to get a CO2, and she may come see you because honestly, she's a beautiful woman, but I can't, when I look at her, all I see is lines above her lip.
But when I do the CO2 here, very often we do it here, and they say, okay, if you can do this here, why don't you just do the rest of my face?
Yeah.
That's very common to do.
That's a good point. Okay, good. Okay, so are these treatments mostly available? Let me ask you a question. There's so many estheticians, and a couple of them are with us today, that I get ads and I see ads like Medi Spas and estheticians, and they're doing all these treatments. Like when I go to QVC, it's in Westchester, Pennsylvania. And there's a host who loves doing Morpheus 8. And I finally looked it up the other night.
Right.
But she doesn't go to a derm. It's like a spa, like a license. So somebody just said I'm a licensed esthetician. And I know you're a derm, and I'm not, taking business away from the derms of the world. But are those places legit, and can you trust them?
They can be legit, and they cannot be legit. It's big business. This whole Medi Spa
business.
This Medi Spa business. I'll be honest with you. It's been taken over by big business. Investment bankers have opened up all these Medi Spas. They've actually bought doctors' offices, and the doctors work in these places. There are PAs, there are nurses, there are NPs, there are estheticians. And the question is, there's not enough rules and regulations who should do what.
Right.
Okay. So a lot of things are being done. I see so many patients that basically, gotten screwed up, okay, by going different places and trusting people. And that doesn't mean you go to one of these places and you're going to have a problem. But I've seen so many problems for people that just were trying to save a little money, and they went to one of these shopping center malls, and they got something done by, I don't know who did it. Right. But then we have a lot of problems in correcting it. It's much harder to correct something that is as a problem than starting originally with the problem originally treated.
Okay, so would your recommendation be that if they're going, let's say they don't live anywhere near where they can get to you, and let's say they're in a area where there's a great Medi Spa that has a good reputation, is there a way of checking to make sure that the person that's going to do the procedure on you is legit?
It's hard to do. I'm gonna say, maybe selfishly say, I think you call your dermatologist, and if you can't get in to see a dermatologist, call them. Yeah. Ask them about the center. Okay. Let them do their research. If you're their patient, they should do a little homework and say, something, you can't get here, but I know that center, I know X, Y, and Z, and you'll be okay with that. Okay. You're not going to do any of these other things I'm talking to you about.
No.
You're not going to, you shouldn't do a Fraxel at these places. You certainly should not ever do a CO2 at any of these places. And you're going to do certainly not liposuction. We didn't talk about that.
Just a minute. The CO2, you have people that work in your office that do it. You don't do them.
I'm the only one that does CO2 in my office.
Oh.
Wow. I don't let anyone else do it.
Oh my gosh, I didn't realize that. Okay. Wait, you don't do facials in your office, do you?
Of course. We have 3 women that do facials, but they're just doing facials. They're not doing anything invasive. Right?
Oh, no. So, and a facial just cleans your skin.
Cleans your skin, They'll do light chemical peels as well.
Okay.
You know, I let them do the Clear and Brilliant, which is like a mini Fraxel.
Okay.
You don't have any harm on that. So they do a number of things that I don't do, that they help me, you know, in terms of people that don't need that much, or they just need a maintenance.
Okay. And now, selfishly, sorry for all the people who are listening. I understand there's something you can do. Now I can't see, but so when you get older, does your nose drop? Is that
Oh
true?
my God. That's what happened to me. I looked at myself in a video a couple of weeks ago.
Oh, you have a good nose.
No, I said, is that me? I thought when I was younger, I had sort of a little Roman nose, and that's not what happened. You lose cartilage in
I feel
your
like,
nose.
look at this. I can move
Yes,
my nose.
that's why you could do that. You couldn't do that when
No.
you were younger. You lose cartilage, and what happens, and with gravity, your nose tilts down.
I know.
And you all of a sudden have a hooked nose that you didn't have before. Now, if you were lucky enough to have one of these little sweet noses, even they come down, but you're not going to have a hooked nose like you would do if you just had an original straight nose when you were younger. No one escapes that. Everyone you see that's an older person will have a little hook in their nose. Gravity wins.
I can't believe how loose my nose is. I'm like,
wins. There's not much to do. What I actually do on some of those people, I actually will
I
sometimes
would be
put a
one
little
of those,
silicone in their nose and
slow
straighten
down.
their nose, but you can't really lift it.
This is time out. That means time out. Because you give a lot of information. It takes me a minute to absorb it. So here's what I want to ask you. I come to you. I want to get that more invasive laser. I can't remember what you called it with an H.
The helix.
Helix. Don't let me forget helix. What are you going to do to my nose? Go slow.
You can't really get rid of a nose that hooks. You get rid of a nose like people had a nose job. They get a little dimple. That people have a little divot in their nose, or over the area where your glasses are, where you just have a little divot and then your nose sort of runs out after that. I could straighten it with a drop of silicone. Now you could use hyaluronic acid, but that you could run into a problem. You don't want, that's a little thick, and you don't want it to inject it into a blood vessel. I just love silicone just for a little divot here, a little divot on the side of the nose. You could use it on the front of the nose to try to lift the nose, but you will never lift a nose that's actually hooking to bring it all the way up. It's just not possible.
Am I hooking?
Are you hooking? Turn around. Slightly, not much.
I think when I smile, I said this on air the other night.
When you smile, you're actually your
when
nose
I smile,
down.
it's like an arrow.
Yeah, your nose hooks down. It brings it down. Actually, Botox would help with that.
It's so damn big, I can't take it anymore.
But if you did Botox, you wouldn't lift the muscles as much, so you wouldn't lift the nose, and the nose wouldn't go down.
Okay. Let me ask you another question. You're friends with all the top plastic surgeons in New York City. Do they have to break my nose if I want them to just fix the tip? They still have to break the nose?
Yeah. There's no other way to do that. They can add cartilage, but if you use just cartilage to your nose and to lift it, you're gonna get a big fat nose, right?
I don't know. I thought someone said now they can do things where they don't break the nose anymore. They could just do the tip.
I don't do that. Is it possible? As far as I know, you usually had to break the nose to fix the tip. But maybe there are newer techniques, with the plastic surgeon that they can do that.
All right. And then can we talk about the other thing?
Which is the other thing?
Yes.
Let me talk to you about a new procedure, My Elevate. Everyone had to do a neck lift before.
Look.
A neck lift could cost $50,000 to $100,000 to get rid of looseness in the skin. We've all seen those bands. You have the bands. Stick your bottom teeth out.
What?
No, let me see your neck. I can't see your neck. So let me see it. Yeah, see those bands? Those are baptismal bands, and we all get them. Okay, we have something called My Elevate. It's a suture that runs underneath the skin and underneath the other band, and then just go back and forth with the suture. It actually cuts the band. The band retracts up into the skin. The lower band retracts down into the skin, and we use a little suture by fiber optic. You can see where you're putting the suture. It goes underneath the skin, around to the ear, and all the way around to your mid neck, and then you tie it underneath the skin, and you'll never see it again. You'll never see the mark. There's no surgery. It's just a suture.
Is that the same as face threads?
No,
Somebody's
no.
asking.
Face threads, they put in the cheek here and there, and the last 3-4 months.
Okay.
I actually don't do it anymore because I find out if people go like this with their hand, it breaks and they're lopsided. Okay, this is This is a polyester thread that basically lasts forever.
And
Nothing's
it lasts forever. I like the
well.
sound of that.
The studies show 7 to 10 years. My Elevate procedure will hold the skin.
Is that a new procedure? Is that new?
It was a procedure several years ago developed by a plastic surgeon, then was bought by a laser company that further developed it. And they have a fiber optic needle now where you run the suture underneath the skin and you can see exactly where you are and go around and tie the skin. So it gets rid of the bands, okay, and it tightens the skin on the neck. It doesn't get rid of the jowls.
No.
The jowls would have to be a facelift and
a lower
neck lift.
But
this is a small procedure, 3 days downtime with a little piece of tape. Its procedure takes about an hour and a half in the office. It's 10% probably the cost of a neck or facelift, and it's all under local anesthesia. No general anesthesia,
okay.
No sedation other than local anesthesia as you would go to the dentist.
And it will look smooth?
It would be great in your case because you only have the bands. You cannot do someone that has the bands and has a turkey neck. It's not going to work.
We gotta wrap up soon. What's Ellacor? Somebody just asked about Ellacor.
Ellacor, I don't have the machine Ellacor. I stayed away from it. It's Ellacor. It takes small little punches of skin out, and each time you do it, it takes about 8% of the skin out, which means if you did the neck and you wanted to tighten the neck, and you took 8% out, then you did it again, 16%. You'd have to do it so many times, and the recuperative period is a long period. It could be 10 days. So I just haven't gotten into that. I have other procedures I think work better than that. I'm not putting down Ellacor, but it's not a non-invasive procedure, and I don't think it does enough in one procedure.
Okay, so we went over, but it was selfishly good information for me. So here's what I want to do. I want to come to you and lay down for a couple hours and just numb me, anesthetize me, and just go hug on my face. And I want everything done. And then we'll do a live, and people will take a shot of this today, and then people will be like, oh my God, look at her, she looks so much better. Okay, now listen, we have to announce winners. And by the way, thank you for those of you who stayed with us during the live. Did he not give the best information? And if all else fails, just put on some better than block. And you need spackle hydrate. This is the best spackle of all my spackles from my dry skin gals. You got to get spackle hydrate. Okay, so I am going to announce one winner that's going to get $250. What? Did you choose a winner on your end, Dr. Sobel?
I didn't even know how to do that.
Okay, so so our office has a thing where we congregate all the people who entered. Thank you, Dana.
I'll let you do that first.
I'm going to do it for you. So, and then they win $250 to Dr. Sobel, right?
And then they mention your name. They come here for 10%.
Like talk to me. Oh, it's 250 each. Two people?
Yes.
Oh, wait a minute. Oh, I get it. Sorry. So this is even better than what I said. Are you ready for this? There's going to be two winners.
Okay.
And each winner gets $250 to me and $250 to you. They're getting $500 worth of services. And hi, Lisa Kalinsky. So the first winner, and we didn't just pick them randomly. I promise you we have a way that we do this. So Coastal Girl 707. And how does she reach us to get the... We'll DM the winners. We'll DM the winners. So Coastal Girl 707 just won $250 to Dr. Sobel and $250 to Laura Geller. And the other winner that Howard Sobel was supposed to pick but didn't is Veronica Icaswell. Veronica Icaswell. I hope you know what that means. And she also wins $500 worth. So thank you, by the way, for those of you who entered. That was so helpful. And congratulations to you. And we'll do more of these in the future. Come back in the fall, we'll do it. And then we'll have other people who have the opportunity to win as well. But is there anything you're working on that you wanted to share with
Yeah,
everybody?
what I basically was working on was the exosomes. It's so new, and that's the world. But oh, by the way, it's not just for the hair.
Yeah, it's for
Okay,
the face too.
the exosomes and the growth factors stimulate collagen and elastin in the skin that we lose, and also help hydrate the skin and help decrease pigmentation as well. It's
Right.
that's the wave of the future. Okay, you know,
Okay.
we all heard of stem
That's
cells, exosomes. They're all part of one product basically, and you see they inject it in knees, they inject it in necks, they inject it in almost everywhere. But now we're doing it in skin and hair.
Oh, that's so helpful. I have to tell you, everybody's saying that the information you gave today was so helpful. I'm seeing everybody's comments, and so I want you to know this was
That's
really,
great.
really.
And they always should call my office. I'm glad to speak to anyone.
No, you guys and Carol at Howard Sobel's office. There is. How long has Carol been with you?
34 years.
Yeah, I mean, really, if that doesn't say, who you are and what you are, we will be
She
posting.
started with me the year I got bar mitzvah.
Oh my
I'm
God. Oh my
kidding.
God.
That was a bad
Yes,
joke.
this Instagram live will live on Laura Geller's site, Laura Geller Beauty. And if you want to come to me personally, it's Laura J. Geller on Instagram Live. And thank you for, I'm reading all your comments, so don't think I didn't see who that was on here. And it will live live and you'll be able to go back and listen to it. So if you missed any part of it,
That's
you'll
great.
have it again.
This is very nice. You asked all the right
Well,
questions. So
thank you. Thank you. You never make me feel foolish, which I really appreciate
no,
about you.
you're knowledgeable as well. And I'm glad I could add things. To
Thank
what.
you. I feel like there's going to be some help for me, and I'm excited about that. So thank you.
Well,
All right.
I
So
hope to see you soon. I hope to see everyone soon.
yes, actually, everybody have a great summer. If I don't see you, just have a great summer and wear your sunscreen. That's
Every
it.
2 hours.
Every
Okay.
2 hours.
Put your moisturizer on while your skin is a little damp. And get rid of those sunspots and wrinkles.
We heard you. We heard you. Okay. Thanks, everybody.
Thank
I'm
you,
going to say
everyone.
goodbye now. Mwah.
Have a good
Mwah.
summer.
Bye.
Bye.